Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. In this presentation, we're going to look at oral semaglutide reduces diabetes and cardiovascular risks. Up to this time, we have been exposed to the injectable form of semaglutide, but now more recently, these oral pills, these oral semaglutides have been shown to reduce blood sugar levels, hemoglobin A1C, and also at the same time reduce cardiovascular risks. We're going to compare that with the injectable semaglutides and see what we can learn. Up to this point, the semaglutides were available only in injectable forms with various trade names such as Ozempic, Wegovy, Manjaro, and other forms of injectable semaglutides, which had to be taken through injections every week for treatment of diabetes, and they have also been used for control of obesity in long-term weight management. This oral semaglutide has been primarily studied in diabetic patients to see how it reduces cardiovascular risk. And this was reported in the 2025 ACC annual meeting. The study was titled SOUL Study Results of Oral Semaglutide. The SOUL Study trial presented at the American College of Cardiology in 2025 at the scientific session. Large number of patients with type 2 diabetes and cardiovascular risk along with the chronic kidney disease. Let's look at some of the outcomes. The study design. It included multi-center randomized double-blind placebo-controlled phase 3B trial. There were 9,650 adults with type 2 diabetes, along with established cardiovascular disease and chronic disease. There was a follow-up duration of more than 4 years. So this is a pretty robust study involving close to 10,000 patients with history of diabetes, cardiovascular disease, and kidney disease who were followed for more than 4 years. So what are the primary and secondary outcomes? There was a 26% reduction in non-fatal heart attacks in the treatment group. The secondary endpoint trial confirmed no significant increase in serious adverse events, supporting the safety profile of these oral semaglutides. Oral semaglutide or GLP-1 receptor agonist semaglutide offers a non-injectable option, making it more accessible for patients hesitant to take injectable treatments. The reduction in the cardiovascular major events, or the MACE or the MACE events, was to a tune of 14% compared with the placebo group. The MACE included cardiovascular deaths, non-fatal myocardial infarctions, and non-fatal strokes. Implications and clinical impact. This is the first oral semaglutide or GLP-1 receptor agonist to demonstrate cardiovascular benefits, expanding treatment options for high-risk patients with type 2 diabetes. These findings highlight potential anti-inflammatory mechanisms contributing to the cardiovascular improvements. Novo Nordisk has submitted a label extension application to the FDA and EMA for Rybelsus to include cardiovascular risk reduction. The results create a new opportunity for patients who are reluctant to take injectable semaglutides to have an option where they can get similar results with oral semaglutide drugs. So, ladies and gentlemen, this is a quick overview of the oral semaglutide drugs that reduce diabetes risk and also cardiovascular risks in patients with diabetes, cardiovascular disease, and chronic kidney disease. Thank you so much for watching this presentation. We have hundreds of presentations on cardiovascular disease. Please do watch them and follow us on our YouTube channel. And please do subscribe to our YouTube channel. I will see you in the next exciting medical presentation.